I'm going to discuss the funding of healthcare systems, specifically evaluating if tax-based funding of health systems is better than social insurance. Before we start addressing the statement, we need to understand that healthcare does not conform to your standard supply and demand economic model. To explain this, let us look at the graph on the left, which represents a consumable. As the price of this particular consumable goes up, the quantity consumed goes down, which in economic terms is known as elastic demand. For example, if a person regularly attends a theatre for entertainment, finds they are unable to continue to afford this due to an increase in price that is not compatible with their income, they may choose alternative, cheaper forms of entertainment. Therefore, the consumption of a good like going to the theatre is reduced. Although this may have a small negative effect on an individual, it cannot be considered a social injustice. However, if a low-income person becomes ill, it is not appropriate that they be denied access to healthcare, and thus healthcare can be considered a human right, which should not be influenced by cost like other commodities. In fact, the World Health Organization's constitution states the enjoyment of the highest attainable standard of health is one of the fundamental rights of every human being without distinction of race, religion, political belief, economic or social condition. In order to evaluate which system is better at providing universal health coverage, I will cover the following over the next few minutes: the importance of universal health coverage, how universal health coverage is funded, which countries adopt a tax-based system and which adopt a social insurance system, which criteria we will use to measure a good healthcare model, and finally, using all this information, try and determine if a tax-based model is actually better than a social insurance model. So why is it so important that everybody has access to healthcare? There is data from studies to show that health can impact economic growth. To illustrate the impact, consider this representation of a virtuous cycle. Good health can lead to reduced absenteeism at work, which would lead to a larger workforce that leads to increased productivity, which results in economic growth. Good health in the younger population would also reduce absenteeism in school, which potentially increases education rates that would have a positive impact on the size of workforce. So what are the different ways we can fund healthcare? The main models of finance are tax-based funding, private health insurance, and social health insurance. The outline of each model is in its purest form. The reality is that most countries use a slightly adjusted version of a particular model or use a combination of models. In a tax-based system, taxes can be collected directly from individuals, households, and companies, or indirectly through taxes applied on the manufacture or sale of goods, which go to the government to distribute health services. In a private health insurance model, both employers and individuals pay into insurance companies either through group schemes, community schemes, or private policies. The insurance companies fund health services accordingly. In a social health insurance model, normally, employees contribute a proportion of their salary with a level of contribution related to income rather than risk of illness. Employee contributions are typically matched by employers. Contributions are paid into sickness funds or insurers which pay for health services. In this argument, we'll be concentrating on tax-based and social insurance. A mistake that is often made when comparing tax-based systems to social insurance systems is that America is used as an example of the social insurance system or a privatized system. This is incorrect, as the American health model is actually a patchwork of all three models discussed earlier. The countries that use tax-based funding include the United Kingdom, Australia, and Canada. Countries which use social insurance systems include Belgium, France, and the Netherlands. So how do we determine which is The criteria that we will use to determine which models are best include equity, risk and adverse selection, moral hazard, and cost effectiveness. I will go into what each one means in more detail. Firstly, let's look at which model provides the more equitable health coverage. In fact, both systems are able to provide equitable health coverage. Tax-based systems acquire funds from multiple sources and individuals contribute regardless of health status, income, or occupation. The compulsory nature of social health insurance systems means that there are always healthy people paying into the system to subsidize care for the sick. As both models are able to provide equal coverage, we move on to our next criteria in our comparison. Adverse selection occurs through the behavior of individuals or insurance company. Risk selection occurs when an insurance company tries to screen potential clients in order to enroll only healthy individuals. Adverse selection occurs when an individual has better information than the insurance company. So why is this such a problem? Well, an individual can sign up to a plan without informing the insurance company how high risk they actually are. Because they are high risk, they are more likely to make claims. This in turn bumps up the premium prices for insurance plans. With an increase in price, healthier low-risk individuals choose other companies for insurance, leading to firms losing business. This cycle is known as a death spiral, which can result in insurance firms going bankrupt. In a tax-based system, adverse selection is not an issue because there is no choice of plan. Nobody has the option to leave the public insurance plan for another one. Risk selection is also effectively eliminated too, as it pools financial and health risk. The sick do not pay more than healthy individuals. In a social health insurance system, adverse selection is minimized due to the compulsory nature of insurance enrollment. People are prevented from leaving the pool when they are healthy. Risk selection is regulated through open enrollment. However, there are examples where insurance companies design care plans based on a specific chronic illness. For example, in the Netherlands, high-risk individuals have to contribute higher co-payments for drugs. Moving on to our third criteria, which is moral hazard. Moral hazard occurs when individuals are more likely to take part in risk-adverse behavior because they are covered by insurance. We can illustrate this through the graph on the right. Let us measure health as a unit. The price of this unit is P1. The amount of units of health consumed by individuals without insurance is Q1, assuming they are paying full price. If an individual is covered by insurance, then the cost of the unit is either free or the individual will only have to contribute a small amount towards it. Because of the reduction in cost of health, the individual will use more of it. The problem of moral hazard can occur in both tax-based and insurance-based systems. Both systems have initiatives to try and prevent this. An example of such an initiative in a tax-based system is gatekeeping. Gatekeeping puts more emphasis on preventative care, early intervention, and better management of chronic diseases. It is designed to reduce queues by controlling the inflow of patients and limiting the demand on specialist services. Social health insurance systems put more emphasis on cost reduction than queue reduction. Some countries try to dissuade overuse through mandatory deductibles, such as in the Netherlands, where on top of mandatory deductibles, people can also choose voluntary deductibles. A study found that health expenditure for people with voluntary deductibles was lower. Let us look at our final criteria, which is cost effectiveness. There is a misconception that tax-based models do not have any incentive to control costs due to lack of competition. Therefore, individuals do not have a choice if prices are increased. In fact, because of investment levels are politically determined, it forces governments to weigh trade-offs between healthcare and other areas of public spending. The National Institute of Clinical Excellence in the UK determines cost effectiveness to ensure costs are controlled, and as an independent body not subject to physician bias. In the social insurance model, price controls are enforced by the government and negotiated between medical professionals and payers. The parties invited to the negotiating table differ from country to country. However, agencies involved in price setting are often constrained by limited information, political pressures, and may be subject to physician bias. Having explored each criteria, we can conclude that both models have advantages and disadvantages. We know that there are many pressures that affect public funding of healthcare: aging societies, technological advances, and economic fluctuations. What is clear from our analysis so far is that this debate is not necessarily about which model is better, but which is more sustainable and will continue to provide universal health coverage even with economic pressure. The graph on the left is taken from a paper looking into the Japanese workforce. It demonstrates that the working age populations in Western countries are set to decline over time. Both models require the financial burdening of the working population. However, in a social insurance model, there is a greater investment required by the individual. A tax-based system is more sustainable as it allows investment over a large share of the population. It can draw on funding from multiple sources, for example, corporation tax and the manufacturing of luxury goods, that do not create a burden on those with lower socioeconomic status. Tax-based systems also do not necessarily take money away from other areas of public spending, as demonstrated by the 2016-17 UK budget, where health received the second highest proportion after social protection. Social health insurance models are more likely to be adversely affected by economic fluctuations. An example is what happened during the economic crisis in Greece in 2008. The financial crisis led to unemployment rates of up to 14% of the population. This affected the amount of money available for healthcare expenditure, which fell by nearly 19%. The deterioration in public health systems due to reduction in funding contributed to an unevenly high morbidity and mortality burden of various large-scale epidemics. So what's our conclusion? Well, both systems have been shown to provide universal health coverage. No system is necessarily better than the other, and cost-effective and efficient healthcare is probably a combination of models. However, in view of an aging population and global economic fluctuations, A tax-based system can draw on a wider source of funding, which will make it more sustainable in the long run at providing universal health coverage. Thank you.